Hello and welcome. Today, in the series of our YouTube channel, we are bringing to you Dr. Sonal Gandhi. Welcome, Dr. Gandhi.
Thank you, Dr. Kashyap. It's a pleasure to be here.
Absolutely. And Dr. Gandhi is one of the research fellows in a prestigious institution in Midwest and US as well. And she has applied this year for medical residency for internal medicine, and she got tons of interviews. Today, we are so delighted that she's here with us, and she is sharing her experience in these interviews as they are winding up at this point. So we are very grateful that you could share some time with us, Dr. Gandhi.
Well, it's a pleasure, as I said, and I'm delighted.
Absolutely. So our first question to you is that how different this year was, and in terms of it, this interview season was way different than anybody has ever imagined. And if you were able to take some advantage of it, can you share with our colleagues?
Certainly. This year, as everybody knows, was virtual. So everybody was at home giving interviews. Scheduling was very easy. You just had to find an available date in your calendar and schedule it since there was no travel. And for me, it was very easy because I would interview during the beginning of the day or during the latter half of the day and resume my work. So those were the advantages that I found, and also we saved a ton of money. I don't know how I would take it or how I would contrast it with the normal interview experience because I haven't been through that. But it is what it is across the board, and everybody was in the same boat. In terms of interviewing, I think people do come across via Zoom, so that wasn't a problem at all. The only disadvantage was you didn't get to experience the vibe of the city. So, yeah, but we are making the best use of it.
Absolutely, and it's different than meeting in person, so you don't get to feel of the program, but then you end up saving a lot of time, and probably you can sign up for more interviews than usually you would be because there's
Right.
no travel involved. Perfect. Second question would be is that what are the common themes during the interviews and in the questions, and how to answer some of them if you had some sort of a recipe to answer certain questions, if you can share with our viewers.
The common theme I would say is most programs are just getting to know you, a sense of you. They've invited you because you have an excellent application or the application that they want, the kind of achievements or the kind of person they want on paper. Now they want to assess you, what kind of a person you are, what your communication, how your communication skills are, or what your critical thinking ability is. So to get to know us, I think some very common questions are: tell me about yourself, strengths, weakness, where do you see yourself in the future. It's a good time to reflect on these and convey these to the program. Other than that, say they do throw in some behavioral questions. And for behavioral questions, again, there's a ton of material or ton of questions available on the internet. And by doing that, they just want to see what critical thinking skills are. If you're robotic or you do have an ability to think and then reflect and at the same time answer. Very rarely they would ask anything to test your clinical acumen. It has happened with me in one interview where they gave me a case and they wanted me to answer specific questions, but that's very rare and you just can't prepare for it. What you can prepare for are the normal generic questions which everybody asks, and that actually takes up 80% of your interview time. You have to be okay with the some googly questions coming and being spontaneous, and that's what happen that's what happens in all the interviews. Coming to the part of how to answer questions, um, I would suggest prepare well in time, prepare well, and by preparation, we know what the common questions are. And what I did was I wrote those questions down and answered them. I mean, I wrote the answers to those questions in points. Remember not to write full sentences because you don't want to sound robotic or that you've crammed the answers. So just keep specific points in mind for all the questions. And remember, those questions are an opportunity for you to throw in something that you want to talk about. Interview is more like a conversation, and remember that you are not the passive person. You have equal control over the interview process. You can steer it in any direction. So keep those things in mind while when you prepare your answers to the questions. Similarly, for behavioral questions, you need to reflect and think of scenarios that have happened in the past. I mean, we've all been through medical school, and in life in general, and we have encountered situations that they want to ask, and they want us to tell them what we did and what we learned. And typically, in behavioral questions, what they want is they want you to answer it in a certain format, which is the star format, if I'm not wrong. It is, you have to describe the situation, what you did task, and then what basically and wind up by saying what you learned out of it. And as I said, you cannot prepare for clinical questions. So those are the questions that are that you have to be spontaneous about.
Excellent. Such a great points, especially that you're not the passive participant in the interview, where you said that you have equal control. That's such a powerful statement, Dr. Gandhi. That kind of should be anxiety relieving for everybody else in that regard.
Yeah, definitely. I do think that you have equal control in an interview, and just not think that you have to answer every question passively. Um, Find opportunities, as I said, find opportunities to slide in some interest, find a common ground. Or if the interviewer is talking about something that interests you, just stop and ask. I mean, just don't stop, but just let the interviewer finish and ask follow-up questions about that. It really is a conversation, and they are looking for people who can have a conversation with, whom they would like to work with, talk to, and would be comfortable with during residency. 3 years is a long time to spend with someone, and residency is so hectic. And so I mean, it's such a people's profession where it's a team profession where everybody comes together. So they're just finding for team players, and who are good team players, people who are, I mean, who are nice people and who can have a conversation. You don't need to be very interesting or very intelligent, but you just have to come across as a nice person. Your achievements are reflected in your era CV. Now what you have to convey is that you're a nice person who can have a good conversation. And that's it. And that's what the
Abs-
interview is about.
Absolutely. So, like that, you were able to use your active listening skills a lot during these interviews as you came up with some of the solution. Did you practice via some medium for your public speaking, active listening skills? Any special training or practices you use, Dr. Gandhi?
I did not have any, training sessions or anything, but I participate in Toastmasters every week. So that was something that I started in September, and of course, it's very helpful in public speaking, listening. The intention was not for the interviews; it's in general. I wanted to improve my communication skills and leadership skills. So that was one thing. Other than that, I practice with my friends. It's important to practice with people who can give you an honest and critical feedback uh, about your content, about your delivery, about your non-verbal cues. So I practice with my friends from medical school who are applying, and people here in the city where I'm staying. Um, and an interview is also a practice. So and I would add to it by saying that after every interview it's important to see what you did not do well and uh, did well and improve upon that. So it's going to be like a whole process. You would get if you want, you would get a lot of interview practice, but just remember that the person that you're practicing with is giving you a good feedback.
So our viewers, those who doesn't know what Toastmasters is, can you tell us what the Toastmasters is?
Toastmasters is an organization across. I mean, is it a pan US? It's pan US, right?
Global.
Yeah, it's a global organization where people of different interests come together. They call it a laboratory where people experiment with their speaking skills, presenting skills. There are a lot of pathways that you can choose, which align with your interests. You should know what you want. For me, I wanted to learn communicating and gain mastery over my presentation skills, so my pathways presentation mastery. And it's very organized because there are a lot of levels, uh, and there are a lot of levels to build upon, and you find wonderful mentors, and Dr. Kashyap is one of the mentors at Toastmasters, and that's where we met. And so I would say it's a wonderful, wonderful platform, not just to learn but to make great contacts, learn from people across all ages. People from all, as I said, people from all walks of life come together, and it's a very collegial, helpful, constructive environment.
Thank you for the shout out for the Toastmasters. So I think so. Everybody does some mistakes, and then we always fearful of that. And I'm sure there might be some times in the early phases of your interviews as well. So any specific areas you want to talk to us? What mistakes you want this year candidates or future candidates to miss, not do those mistakes if in early phases, whatever it was, maybe one or two.
Well, I can talk about my mistakes, and I think in the beginning I was a bit more generic. My answers were a bit more generic, and I think it's very important to give specific answers. And what I mean by saying that is, if they give you any question, if you tie it with an example in your life, it it makes the answer more memorable, and it makes it more real. For example, if they ask you about what are your strengths, and for example you say that you are a good team player, tie it with an example why you say that you're a good team player, that you've worked in so many teams as a member or a leader and successfully navigated any specific situation. If you say you're a hard worker, give an example where you displayed a good amount of hard work. So that is one thing that I worked on, as as I went from interview to interview. And the other thing was, I realized that interview is more like a conversation. Don't wait for them to ask you something that you are really, want to tell them. You find an opportunity yourself to drive the conversation in that particular direction, and find something that you can talk about, which is your forte. For some people it's mental wellness, for some people they want to talk about their hobbies. You can actually, an interview is for just 20 minutes, 25 minutes, or 30 minutes. Sometimes it's even less than that. So if you can talk about 5 6 minutes about something that really interests you, it shows how enthusiastic and how personable you are, and that really goes a long way. The interviewers also interview a ton of applicants, and they would only remember you if you give them something to remember. And while doing that, you don't have to be you don't have to be extraordinary. All, like, I'm an ordinary person, but I do have some interests that I work on, and sometimes you might just find a common interest with the interviewer and just talk about that. So the second thing is, it's more like a conversation, and I realized that it's just and you don't need to be nervous about it. uh, I think those were my mistakes. And practice as an IMG, or and English is my second language. I think I was. It is important for us to work on that aspect as well. Um, Accent is okay, but it's just, your speech should come across organized. Don't jump onto answers. uh, Form an answer in your head, organize it, and then speak it. And this is something that I learned. There's a trick that I learned from Toastmasters, that is to speak very slowly. I mean, think ahead and then speak later. The thought should come in your mind first, and then the speech should come out of your mouth later. So work on that.
Yeah,
I think that's it.
it's hard to do that, but I think that's a very important advice. So we are almost at the end of our interview. So if you need, we want our audience to summarize any three or two three take home messages from what you have talked so far. What would your top three summary as a bullet point for our reviewers, Dr. Gandhi?
The first thing is prepare well, and by preparation, I mean have an idea of what you're going to say. Two is, I did not touch upon this, but I want to say it now. Research about the program well. You do not want to ask questions, or you do not want to come across as uninformed. You don't want to ask questions that have already been answered on their website, or they've answered in their presentations. You can ask follow-up questions from them, or you can ask them to elaborate about something that you found interesting on their website or on in their presentation. And prepare questions. uh, they always ask questions. If we have any questions for them, it would sound that you are very uninterested if you do not have any questions to ask. So, and it's not necessary that you have very specific questions about that program. You can ask generic questions as well, but do ask questions. Prepare 5 to 6 questions, because some questions might get answered in the presentations, or somebody else might ask them in the common room. So prepare 5 to 6 questions. Smile, be enthusiastic. We all love company of enthusiastic and nice people. Just be nice, sound enthusiastic. um, and what else I would say that learn on your just keep on improving. It's a marathon. It's You get opportunities to learn and grow. So after every interview, reflect and see what are the areas that needs improvement, or what are the answers that might need a bit of tweaking. That's it.
Perfect. That was really informative. Thank you so much, Dr. Gandhi, for sparing time with us. We hope to have you back again, probably in the last week of March, with a different questions at the time. Fingers crossed that you can share your experience for those things. For our viewers, please like our video, subscribe to our channel, write in comment section what topics you want us to record further, and then we'll try to bring back Dr. Gandhi and others when time is appropriate, probably in the March end. Thank you for so much for joining us. Thank you, Dr. Gandhi.
Thank you, Dr. Kassav. It was wonderful interacting with you.
Absolutely.